Hi, welcome back to my channel. It's Dr. Erica again. Today is MLK Day. Happy MLK Day. A day of peace, a day of gathering, humanitarian, holistic, nonviolent expression of our Constitution here in the United States. Thank you for joining me. This is Dr. Erica, pharmacist for 12 years now. Please like, share, and subscribe if you haven't already. My main channel is called Erica OnagbolaPharmD. On that channel, I talk about disease states, medication prevention, medication treatment, side effects, drug profiling, what to do to help every day with your self-care and your exercising routine. I also talk about nutrition and dieting. This channel, I'm talking about delicious foods. I'm talking about exercise, self-care, biblical thinking. I'm talking about travel and also the newest and latest pharmaceutical innovation. That's what I'm talking about on this particular channel. Thank you for joining me. If you haven't already, share, like, and subscribe. This particular video, I'm just recapping, just talking about Xelstrym, dextro-amphetamine. Dextrum formulation comes in four sizes as meaning the diameter of the patch itself, depending on the strength. The strength is lower, that patch is going to be small. If the strength is higher, that patch is going to be a lot larger. Now, this particular medication has been on the market for a while now, and it's a formulation that a lot of people have taken interest in. Usually this dextroamphetamine or Concerta or Adderall XR or Adderall IR. However, the formulation occurs, this is the only patch that is in the for the dextroamphetamine. So again, this is the only patch for the dextroamphetamine. This patch can be placed on the skin topically for 9 hours per 24 hour. Again, it can be placed on the skin for 9 hours for every 1 day. It can be placed on the upper torso of the body. That includes the upper back, the upper arm, the flank area, the front of the torso. I suggest to reduce side effects of skin irritation due to the adhesive material on the patch, to rotate the site of placement. That could be like, for example, Monday, the upper arm, Tuesday, the upper back. However you choose the healthiest way for you. That is only my suggestion as a pharmacist. When you get ready to throw your patch away, you're going to remove the patch, you're going to fold it in half and discard it. However, the package insert that manually comes with the actual package product is going to have the instructions directly for you to handle that process. So do be aware of that and be mindful that the package insert, you're going to read it, unfold it, and then you're going to actually find out how to discard it properly depending on the manufacturer. So what's the purpose of the dextroamphetamine? Dextroamphetamine is a stimulant. It's a brain stimulant. It is for active hyper attention disorder in pediatric patients, in adults. But the patch is for patients who are adults and older pediatric patients, just because it might cause some side effects in the earlier years of the pediatric patient. So it's mainly for teenagers or older pediatric patients, not for the younger ones, because again, the side effect risk. Now, I've really never met someone who has taken the medication acutely and have stopped the medication. Usually it's a long-term medication, and the formulation rather can change. throughout the use of the dextroamphetamine salt. For example, you might start off with a capsule, or you might start off with a tablet and work your way up to the patch, just depending on your preference or the physician's preference at that particular time. I don't want to say exactly when it's appropriate to start on the patch. Someone who is naive to dextroamphetamine may or may not do okay. It just depends on the responsibility of the individual. Um, I have never seen, like I said, someone to stop abruptly taking the medication because it is a stimulant. There may be some reversal adverse effects. I don't want to recommend that you stop taking the medication. Let your doctor know first that you're interested in doing so, and let them taper you off of the medication. They'll taper you off dose by dose until it's completely gone. So do be mindful of that. And ADHD. What do I know about ADHD offhand? Um, I guess I can just, tell you that it's a controlled Schedule 2 medication. It's regulated, highly regulated by the pharmacist and by uh, the the Board of Pharmacy. Federal and state laws regulate Schedule 2 medications. That includes the storage, the accessibility, the dispensing, the monitoring, the caretaking of the actual tablets, the formulation, and then the relationship between the physician and the product, the physician and the customer. So we want to keep it as a Schedule 2 regulated medication. And again, just if you notice that you're dealing with the inability to focus, or you're dealing with the inability to stay on task or to multitask, then yes, you may or may not have ADHD, but you may qualify, for a prescription medication. I can't recommend anything over the counter for ADHD because, again, it's a Schedule 2. It is highly regulated by physicians and so forth. There's testing and so forth that has to go in place first before any prescription can be warranted. So if you have any questions, any shares, any issues, any topics that you want to learn about more about this medication, please let me know. This is Erica Onagbola, pharmacist, 12 years. Thank you for joining me, and please visit my other videos on Erica OnagbolaPharmD, where I talk about Xelstrym, talk about other dextroamphetamine formulations as well. And have a good day. Happy MLK Day. Bye-bye. Dr. Erica signing off.